With the femtosecond laser, we are still afraid to get LASIK done. You would see so many of us still wearing glasses. What is it that is preventing us from getting LASIK done? This very rare chance of getting an ectasia because there is a flap in your eye. This chance of having a flap displacement getting later on, or the dry eyes. What is it that is preventing us from getting LASIK done on our eyes? These are the issues that is actually preventing us because you feel it's not safe. So what if there is a technique which can answer these? Then would it be easier a decision? Especially if you are in contact sports, if you are in a profession that requires, say, swimming, you are a scuba diver, you are an astronaut. What would you prefer, a flap or no flap? There are also these other things involved when you are using two lasers, especially an excimer laser, which is a gas-based laser, the performance of which depends on so many factors. The very difference in the hydration of the cornea, environmental factors like humidity, organic vapors, and if the fluence is linear, and therefore these scatter in the high myopic age group, and therefore enters relaxed smile. Excuse me? For the people who are not so familiar with this new technique, this is a cone, it's an all-in-one femtosecond laser treatment where one pass of the femtosecond laser is done to form a lenticule within the corneal tissue. So this is the posterior part of the lenticule. There is another pass which occurs anterior to this one, which is separated from the posterior one by the amount of correction required. And this goes a little beyond and forms a cap, followed by a very small incision. And as you can see, this can then be very easily removed. The lenticule that you separated inside can very easily be removed through that small incision. No flap means no flap related issue. Small incision means you are severing only few nerves and therefore less chances of having dry eyes. And this very fact that you are retaining the biomechanical strength of the cornea by not forming a flap is the one that's going to make you decide whether you want femtolasic or smile in your eye or in your patient's eye. And therefore, when I started, I said there is no debate here. It is a much superior technique if you want a laser refractive correction on your cornea. You can see that the separation is pretty easy. I'll just go a little faster here. I'm trying to fast forward this so that we can see the lenticule coming out. Once you have separated both, you can deliver this lenticule out of merely 3 mm incision. We are also working on techniques which can reduce this size even further. Better biomechanical strength, it's like having a PRK done without pain, a LASIK done without a flap, and therefore I would say small is beautiful. Just give me half a minute. Ladies here, which rock would you prefer? And which car would you prefer? Ooh or ah? Slow or swift? Ouch. Old or new? LASIK or smile? The decision is yours. Thank you.